Hello everyone, welcome to the 17th edition of Spotters and Booster on Learning Pharmacology, and the focus is on the AETCOM Module 2.2 that deals with bioethics. Bioethics is the study of ethics and moral principles in biology, human sciences, medicine and biomedical research. Medical or clinical ethics is the use of moral conduct and ethical principles by doctors in medical practice. There are four pillars of ethics as shown in the pictorial: autonomy, beneficence, non-maleficence, and justice. The questions need to be addressed as describe and discuss the role of non-maleficence as a guiding principle in patient care. Describe and discuss the role of autonomy as and shared responsibility as a guiding principle. And this way that these five have to be addressed, and I shall address each one. Number one, role of non-maleficence as a guiding principle in patient care. Primum non nocere is an age-old adage, and that shows first do no harm. Remedy should not be worse than the disease itself. And nobody wants drug-induced disease. So non-maleficence is a critical component in healthcare and drug research. It envisages utmost care and practice of medicine to protect individuals, particularly vulnerable groups, children, pregnant women, elderly, from harm of the therapy. And harm can be of various types: physical, psychological, economic, and social harm. And this harm is not only due to drug, but the behavior of the doctor can also produce harm. It also includes acts of omission. Every effort should be made to use drugs that are well studied and relatively safer and cheaper. Not following this principle during medical practice may invite issues of negligence and professional. The harms produced by treatment, therapy, or doctor-patient interaction. Physical harm, treatment-related harms that may be temporary or permanent, necessitated hospitalizations or damage organ function. Intentional withholding treatment is another form of maleficence that may harm a critically sick patient. Psychological harm can be misconduct or behavioral issues during doctor-patient interaction may cause this harm. Social harm is divulging patients' disease-related information by not maintaining confidentiality will cause the loss of prestige in society. And a financial harm is prescribing costly medicines, too many medicines, not following a standard of care and guidelines that will cause financial harm. When it is not possible for completely eliminating the risk of the harm, for example, ADRs of the drugs, there one should minimize the harm by appropriate selection of the drug and appropriate information to the patient for getting consent. Second point is describe and discuss the role of autonomy and shared responsibility as a guiding principle. Very important consideration. Autonomy refers to personal freedom to determine actions and behavior. The principle of autonomy appears in World Medical Association Declaration of Geneva in 48, International Code of Medical Ethics 49, and Indian Medical Council Act Professional Conduct Etiquettes Regulation 2002-2009, and now through NMC draft. This is based on human rights approach in healthcare, and it has replaced ancient paternal healthcare approach. Earlier, doctors used to say, do as I suggest. Now it is, let us come together and find out the solution. So this type of a difference is there now. All have right to determine what shall be done with their bodies. Individuals of the society, including sick, have power of self-determination, therefore have right to choose what they think is best for their ailing body also. As doctors, we should respect human dignity and health-related decisions taken by the patients, even when it could be harmful to the sick, but we have to respect the autonomy of patient. Shared decision making promotes autonomy. Exceptions are there where doctors' autonomy overrules patients' autonomy, emergency, child, unconscious patient, and here doctor will act in the best interest of. There are three basic elements of autonomy. Necessity of disclosing adequate information, that should be evidence-based availability of literature to get the informed consent after giving information. Second is greater involvement, participation of patient in making health-related decisions. That includes collaboration, self-governance, and shared responsibility. And the third element is derivatives of autonomy should be used, confidentiality and truth-telling in achieving the goal. Now, key elements is disclosure of information, all necessary details to be provided to make an informed decision, facilitation of understanding, ensure that patient has understood what we have said. That means we should use the language, simple language that patient can understand, and promotion of voluntariness. No coercion or undue influence should be given to get a free and fair consent. It safeguards the patient's right to decision. Shared responsibility is yet another evolving concept that has now percolated into healthcare services. The physician, patient, and family member work as team to improve patients' health outcomes. Studies suggest that patients who share responsibility for their medical care have the best outcomes because they are well informed and actively engaged to achieve the treatment goals. And therefore, doctors must help patients understand benefits and risks of the alternatives for making thoughtful choices, and doctors should align such recommendations with the patient's goals as envisaged by the patient to make them consistent and relevant. A major advantage of active involvement of patient and family members is motivation to adhere to treatment protocols. Therefore, treatment adherence and success of therapy improves. Patients should take responsibility by active involvement in preparation and implementation of a treatment plan and follow treatment regime and blood tests as discussed and agreed upon, and make a record of the changes for further discussion, particularly when patient therapy is prolonged in chronic disorders. Patient should communicate truthfully his concerns and impact of the therapy in subsequent. Now, third is the role of beneficence as a guiding principle in patient care. The principle of beneficence is the core ethics principle and denotes obligation on doctor to apply knowledge and skill, I would say wisdom, to do good for the patient, to promote welfare, and to act in the best interest of patient. The principle of justice is necessary prerequisite for act of beneficence. In this way, he defends the right of the patient also. And to do so, beneficial acts doctor takes oath of selfless service beginning the career. The principle of beneficence also applies to society. A doctor plays a role in public health improvement by care and education. In past, physicians served the patient without any consideration, financial or other, to pay back to society as a gratitude what he got to become doctor. But the times are changing and needs and demands are. Subtle acts of beneficence are there which a doctor can practice actually. It is the duty of doctor to take a proper history, do proper clinical examination, narrowing down differential diagnosis so that fewer relevant investigations to support and confirm diagnosis are ordered. This would avoid discomfort and spending too much on lab tests. So this is an act of beneficence. Another example is Prescribing generics and limited number of medicines of which the doctor knows the most makes monitoring easy, reduces cost and avoids ADRs. And by communicating effectively, using empathy and ethics to develop trustworthiness, and this helps in achieving treatment goals. Regular use of empathy in daily practice is key component of benefit. Fourth, describe and discuss the role of physician in the healthcare system. The NMC regulation gives a detailed account on the role of the Indian medical graduate, and doctor will play five cardinal roles: clinician, leader and member of the healthcare team and system, communicator, lifelong learner, and a professional. A professional who is competent, responsive, accountable, and ethical. The additional role is role model in society to inspire future generation. So doctor plays multiple roles, and the details of the account can be seen in the AETCOM competency module issued by MCI and currently available under NMC. I will not go into details of this, but it must be stressed that doctor has much more greater, larger role than as a clinician. Fifth is role of justice as a guiding principle in patient care. Now, justice is to give what is due to the patient. A sick requires standard care by a competent graduate doctor. Distributed justice is used in healthcare to provide fair and equitable treatment to all sick, equitable distribution of the healthcare resources and services. Some examples are using same low cost effective medicine for all patients with similar disease irrespective of the social status. Allotment of the equipment, test, medicine, care of uninsured patients, and allotment of time for outpatient visits based on the need of patient rather than status of the. For further reading, there is a good literature available, YouTube's otherwise also, and you may also visit the next episode for understanding AETCOM module 2.5. Thank you.